This organization was formed in 1983 by Dr. Edward Mason, who's also recognized as the father of modern bariatric surgery.
Dr. Mason performed the first gastric bypass for morbid obesity in 1966 and then designed the vertical banded gastroplasty operation in 1980.
Dr. Mason is also the founding president of the society and the founder-director of the International Bariatric Surgery Registry.
Before the meeting, we talked with Dr. Mason about his pioneering efforts in bariatric surgery.
Sharon, I obtained my surgical training and a PhD at the University of Minnesota under O.N.H. Wangenstein, who used a Billroth 2 type of subtotal gastrectomy for treatment of peptic ulcer. Gastric bypass made use of Wangenstein's ulcer operation, but with bypass of the stomach instead of removal. In 1965, I began 3 years of research in our surgery laboratory at the University of Iowa to determine the safety of gastric bypass. Chikashi Ito, a surgeon from Sapporo, Japan, assisted me. In 1966, I began gastric bypass in the treatment of severely obese patients. Referrals came from relatives and friends of patients who had gastric bypass. No referrals came from other physicians. In 1967, our initial experience was published as a part of a celebration in honor of O.N.H. Wangenstein. For 10 years, there were no papers by anyone else. Then, in 1977, 7 papers appeared from other centers. Gradually, gastric bypass replaced intestinal bypass. In 1971, we began using horizontal gastroplasty to avoid the complications of gastric bypass. In 1980, I began vertical banded gastroplasty. Failure of surgeons to follow the guidelines for vertical banded gastroplasty caused many surgeons to return to Roux-en-Y gastric bypass. Ward Griffin, a Wangenstein-trained surgeon, introduced Roux-en-Y gastric bypass in 1977, and it remains the most popular operation in 2008.